Hi, my name is Nathan Wong from the University of California, Irvine, and I'm editor-in-chief of the CardioSource Clinical Community on Cardiometabolic Disease. I'm here with Dr. Michael Blaha from Johns Hopkins University, the associate editor for this clinical community. We're here to share with you our perspectives about some aspects of the newly released obesity guidelines, which was actually jointly released by the ACC, AHA, and the Obesity Society recently. And these guidelines really have provided some more specific recommendations about assessment of obesity and what types of interventions might be most helpful for actually weight loss. I think one of the things that kind of stood out in my mind is, they focused mainly on still using the body mass index for assessment of obesity, and I think, we all know that actually waist circumference is a better predictor. They did have some recommendations in there to measure waist circumference. Perhaps that could have come out a little bit more strongly, and ideally we want to try to get doctors measuring waist circumference on a regular basis, right?
Yeah, so I think the general tool we'll use for screening for obesity will remain BMI for screening for obesity, but when you want to communicate with patients about their cardiometabolic risk, really waist circumference does trump BMI. So BMI to screen for obesity, waist circumference for further cardiometabolic risk assessment and for communication with patients, and a goal for them to try to reduce that waist circumference.
But how do you think we can really because I think clearly we understand that the waist circumference is a stronger predictor of risk of both diabetes and cardiovascular disease. And how do you think we could really get that better implemented? Maybe we should have the ACC send every member a waist circumference tape. Wouldn't that be a great idea?
Having tape measures in hand makes a big difference. The other thing is I think a lot of us are moving to more of a clinic setting where we have assistants who check in our patients. They can also make those waist circumference measurements, and you just have to communicate to your clinic that that's important. And you have to get used to incorporating these into practice. And I find it very helpful in my own clinic, and patients usually understand that trimming themselves in the abdomen makes a big difference for heart health.
Great, yeah. And I think one of the very important messages from these guidelines really was the statement that we need to impress upon our patients that even moderate amounts of weight loss of even 3 to 5% of their body weight can result in very important reductions in the cardiometabolic risk factors.
I think this is a huge point because patients, I think, sometimes I joke to my patients, you don't need to get back down to your bikini weight, or you don't need to get back to your swimsuit weight. 3 to 5% of weight loss will make a big difference. And it says a target weight loss of 10% will make a dramatic difference in your risk factors. So telling a patient they need to lose 10% of their weight, I think changes the equation for them when they might be thinking that I'll just never lose all that weight if we're thinking about sometimes 50, 100 pounds. But 10% is doable for most patients.
And I think really given that obesity has been classified by the American Medical Association now as a disease, I think it's really very important that we help educate patients as to all the other related diseases that come along with obesity, particularly diabetes, which continues to rise dramatically throughout the world, as well as cardiovascular disease.
Yeah, and so the guidelines do recommend for an intensive, comprehensive intervention with multiple specialists, including, of course, the physician, but also dietitians and exercise folks. And really, it's pretty profound in the guideline. They say at least 14 sessions of these intensive therapy, that's a lot, and spread out over the course of a year. So while I think that's a wonderful recommendation, wonderful guideline, I still can't wait to see how we're going to operationalize this in practice, because that's a big time investment on patients and also payers.
Yeah, and I think it's very, very important that the payers step up to the plate and really recognize the importance of including registered dietitians in management of weight issues, as well as exercise physiologists, and they are really a crucial part of the cardiovascular team.
Yeah, it's a team effort when it comes to obesity for sure. But I think these guidelines certainly are nice to have a separate document to address this, to tell primary care doctors and all physicians that this is an important issue. Now you have a separate document to go to for how to guide that visit with the patient.
And I think, really it's fantastic that the ACC and the AHA has, really taken a step in putting out these guidelines on obesity and its importance in cardiovascular disease.